The coronavirus continues to spread and the death toll has risen to above 900. As a result, the UK government has now classified the coronavirus outbreak as a serious and imminent threat to public health. For the latest now, let me take you to London now, and we're joined by ENCA's Oli Barrett for an update. So, Oli, the number of cases, from what I've seen, has gone from 4 to 8, and it seems to be centered around the town of Brighton.
Yes, that's right. We have a doubling of confirmed cases here in the UK, up to 8. So these 4 new cases, according to health officials here, all relate to one of the previous 4 confirmed cases in Britain. That is a man who had travelled to Singapore. We believe he caught coronavirus at a conference there. But on his way back to the UK, he stopped off at a ski resort in France. That is where we understand that these 4 new confirmed cases in the UK caught it. They caught it from him in France and have all travelled back to the UK since. So that means that these 4 new cases are related to that man who lives in Brighton, tested positive for coronavirus there and was then transferred to a London hospital for treatment. So these 4 new cases related to that individual who'd been in Singapore and then France, also now going to be treated at London hospitals. As you say, confirmed cases up to 8 now in the UK.
And these include a medical practitioner, a doctor.
What officials here are saying in the UK is that all of these 4 new cases were contacts of the businessman who had been diagnosed in Brighton. They caught the virus off him in France. It's also understood that several other British citizens caught the virus from this individual in France.
Right.
Those individuals remain in France, we understand. So this really underscores the international manner of this outbreak and the fact that it's very difficult to get on top of it when you have these individuals travelling around the world, crossing borders, several borders sometimes on their way back to their country of origin. Very difficult indeed for that very reason for health officials to keep the spread under control.
So what does declaring it a serious and imminent threat to public health entail, Oli?
Well, it's slightly confusing, really, because at the same time as health officials here are declaring this a serious and imminent threat to public health, they are also saying that the risk to the wider public has not risen. They continue to describe that as moderate. Now, the reason for that is that what health officials here in the UK are doing is making this new classification of a serious and imminent threat to public health so that they can bring into force various measures to try and stop the spread of coronavirus. The reason they are doing it is actually quite specific. It's because one person, one individual who was among the dozens of people repatriated to the UK from Wuhan in China, the epicentre of the outbreak, at least one of those people, we understand, was resisting the requirement for him to remain in quarantine, which is where all of those people who've come back to the UK from Wuhan remain, along with all of those, of course, confirmed cases of coronavirus. Well, health officials were very worried about the idea of people effectively checking themselves out of quarantine, so they brought in this new classification of the threat to public health so that they have more power, more legal basis, really, to keep people in quarantine, even if it is against their wishes. That means that, as I say, anyone confirmed to have coronavirus and anyone who's come back from Wuhan in China can be kept now in quarantine. That's happening in Milton Keynes, a town in the UK, and the Wirral as well, those 2 locations where dozens of people remain in quarantine.
So you Brits debate the state of the NHS quite extensively and quite vigorously. Even in the recent election, it was one of the many topics that were being debated. Is the focus again on the NHS and its ability to respond should there be a need to scale up the preemptive response, but also should there be a need to respond to the coronavirus?
Certainly there is a huge focus on the NHS and its ability to respond here, not least because this is the time of year when we often are dealing with seasonal flu outbreaks, which often cause great strain on NHS services up and down the United Kingdom, real strain on the amount of beds that are available, for example, the amount of doctor's appointments that people need, the type of treatment that people receive at this time of year for a seasonal flu. Not dissimilar, of course, in the way that individuals are treated with regards to the coronavirus outbreak. One other real area of focus and attention on the NHS is its communications here. Some are asking questions about whether it's been doing enough to communicate the dangers of coronavirus to people, to tell them exactly what to do if they believe they might be suffering from coronavirus, the advice to people who are coming back to the UK from Asia. At the moment, there are a series of Asian countries and territories, and the Foreign Office is saying if you come back to the UK from any of those places, check yourself for symptoms. If you believe you're demonstrating any of those symptoms, stay at home, don't go to the doctor immediately, call the NHS and take the advice from there. But as I say, some are questioning whether the NHS is doing enough to get that message out.
Oli, good to see you. Oli Barrett, live for us from London there with an update about the situation as that country responds to the number of cases that are confirmed in as far as the coronavirus is concerned in that particular country.